Hi, Russ Dunning here with Kind Performance Physical Therapy. I'm here to talk about knee pain, and specifically the knee pain that's in the front part of your knee. Doctors might call this patellofemoral syndrome. Now, before you go onto Google and research that syndrome, I'm just going to cut right to the chase and tell you the majority of the issues of what they entail and how to fix them. Okay, so that knee pain many times could be on the bottom of the kneecap. It could be on the sides, both the outside aspect, the inside aspect, or in the front, or more often than not, it can feel directly behind the kneecap. Now, some people who say you're a little bit older, maybe in your 50s or 60s or your 70s, some people might attribute this to arthritis. And before we go there, I want to say this. Any dysfunction through the front part of your hip, thigh, and particularly in the knee is going to compress your joint a lot more aggressively than what our body's original intention was. So it can magnify issues, magnify arthritic conditions, magnify old tears and old trauma. So before you just chalk it up to a diagnosis that we can't do anything about and we can't fix, let's focus on the issues that we can fix, and largely how well the front part of our thigh and leg move and how well does the backside control it. Because I'm going to spill a little secret throughout this little mobility complex. So one of the first things to assess if you have knee pain, again, this is knee pain with maybe walking downstairs or walking downhill, maybe getting up and down off the ground, maybe doing a squat or kind of sitting down into a low chair. This is the knee pain that affects people as they move. And as you move around, whether it's first thing in the morning or at the end of a long hike, what I first want you to assess is how well does this tissue move? And we can assess that by lying on your stomach. So lie on your stomach, and I want to see, you can use a strap here, whether it's a strap or a belt or some band, or you can grab it with your own hand, but usually people cramp up in their hamstring if they try and grab it like this. But I want to see how well does your heel get to your butt. And if you're like most people, especially when you have this pain pattern, the movement stops right about here. Now, let's take a look at that. Many times the knee joint, if we assess the knee joint sitting, it can go all the way. But if you lie in this position, it can only go so much, and people will say, oh, that's too tight. The front part of my thigh is too tight. The quad or the hip flexor is too tight. So here's your simple method. It's an A and a B step to improve how well you move that many times reduces your knee pain. So we want this to improve. We have our favorite stretch of all time. That favorite stretch is a standing stretch. So go stand up for me, and you're going to put your leg behind the table. You need to find an object, usually at the back of the couch, or the side of the couch works really well. Usually anywhere from your thigh to your hip. You're going to get your foot up on it. Now the secret here is a strong stomach and bend the down knee. The reason why, if you don't tighten your belly here, go ahead and relax your stomach. It's going to allow your spine to extend. That's going to take up slack. It's going to have your hip and your back compensate for tight tissue through the front part of the thigh. So by tightening up the stomach, you take up the slack through that front tissue. If you can get your heel to your butt and your knee is in line from your knee through your hip to your shoulder, this makes a straight line. You get fully pliable through the front part of your thigh, particularly the tendon complex close to the kneecap itself. This is an extremely important step to improve the flexibility that leads to a better functioning knee. Rest. Now you can do this for 3, 4, 5 reps. Sometimes you can hold from anywhere between 15 to 30 seconds. Okay? So this is your standing quad stretch. There's a lot of variations to this, but this is one of the safest ways of doing it. If you're off balance, I recommend you hold on to something while you do it. Okay, now that's step A. That alone can be a huge breakthrough in how well the knee moves. And we have tools such as floss bands and cups to facilitate that, whether that's at your own home or you're here in the clinic. Okay? After you improve on the flexibility, you now need to use that motion. Here's the biggest secret I want to share with you. If you stretch and you do not use that motion functionally, that stretch will not last. And you will feel like every morning is Groundhog Day, and you will wake up with the same tension. So to fix it, you have to get strong in that lengthened position. One of the easiest paths to get strong in that position is your glutes. So lie on your back. So on the floor, when this area is tight and it adversely affects your knee pain, you can't do a hip bridge very high. So I'm going to have Kiara pretend like she has tight quads, okay? So she's getting into a bridge position, and I want you to go up only maybe halfway, and I want you to extend your spine so you're kind of arching your spine, okay? If the spine is arched, you're not lengthening the front part of the thigh right here, okay? Rest. So many times when we have tightness to the front part of the thigh and it gives us knee pain, we see that someone can't do a high hip bridge. Now, the hip bridge should be on the same line as your knee to your shoulder. So we're going to draw an imaginary line. And now Kiara's going to raise up her hips as high as possible. That hip joint should be right in line with the knee through the shoulder with no compensation through the back. So we say belly tight right here. Belly tight. Perfect. Come on back down. Now, if you do that, you might hurt, and it's different than what you think. Your hamstrings might cramp up because they're not used to that position and they're working too darn hard because of a lack of glute effort and proper flexibility through here. So if you cramp up, no, it's not bananas. You're not alone. Everyone cramps in that position when they have this tightness dysfunction. So after you stretch and get the front tissue more pliable, I want you to do 5 to 10 hip bridges at full height. The better your hip bridge height, the healthier your knee is. So that's going to be your quick knee fix for the majority of knee issues. We can help you assess that. We can help you give you tools to correct this at home, both live or virtually. Connect with us for more information. Find us at keimperformance.com. Thanks. Have a good day.